Today's topic is breastfeeding, especially people who are having trouble breastfeeding. My name is Dr. Noha Polack. I'm a pediatrician. I've been practicing pediatrics in Union City and Bayonne, New Jersey since 1996. And I'm joined today by Dr. Giselle Tadros.
Hello, everybody. My name is Dr. Giselle Tadros. I am the owner of In-Home Pediatric PT, where we provide physical therapy services for babies from womb all the way to 18 years old in the comfort of their own homes.
That's so exciting. Thank you for joining me today, Dr. Tadros. I see many newborns in the office, and some of them are having a real hard time breastfeeding. So the way I try to address breastfeeding issues in newborns is to figure out what the problem is, whether it is supply, right? Is the mom having a hard time with supply? And we have many ways of helping mom increase her supply. Whether there's a problem of transfer, that means the baby cannot transfer the breast milk from mom to themselves, or whether it's a problem of the baby simply being too sleepy and not feeding, right? But instead sleeping as soon as they go on the mom. So today we're going to address the problem of transfer. Transfer can be baby cannot open their mouth properly. The baby could have a tongue tie. The baby could have a shallow latch. So Dr. Tadros, can you educate us about those kinds of problems?
Sure. So there are specific things that a baby has to do, and they're sort of born with these reflexes that allow them to be able to transfer milk. So something like rooting allows them to look for and find the breast and open wide. And then the suck reflex also allows them to naturally suck and transfer that milk. When a baby sucks, the tongue has to elevate and cup and latch onto the mom's nipple or a bottle. And from there, that forms a vacuum, and the milk will just sort of automatically flow. So if everything is working correctly, this mechanism should naturally happen and the baby should be doing well. These reflexes usually last for the first 3 months of life, at which point then mom's hormones will regulate, because usually that's what's driving the milk transfer and the supply is mom's hormones. But then as those sort of regulate, it's the baby's job now to start pulling that milk out of the breast, and emptying the breast is what signals the brain to refill the breast. And so that's sort of the mechanism that we're looking for. A lot of times we find that the baby is having trouble for a variety of different reasons. I found that babies can have trouble latching. They may have discoordinated abilities to suck, swallow, breathe. Sometimes mom can get plugged ducts and mastitis, breast or nipple pain, because the baby is unable to transfer that milk from breast into their mouth. There's a couple signs that I look for, something like whiteness on the tongue. That sort of indicates to me that the tongue is not touching the roof of the mouth. So when the baby does that kind of a movement, and I'm sorry for sticking my tongue out at you, it just allows them to clear that white coat that sits on the tongue. If you're seeing that white coat of milk and it's not thrush, you have to be able to distinguish between them. That shows to me that the baby is unable to elevate their tongue up enough in order to get that nice suction to a mom's nipple or bottle, as we talked about. Some of the babies can have a hypersensitive gag reflex as well, and that can sometimes get in the way of that transfer. And some babies just have trouble with the mechanism in general. So the reflexes may need a little bit of help to get started. And that's where physical therapy can help address some of those things.
Gotcha. So the main thing that I look for on a baby's first visit is that they have not lost more than 7% of their body weight by the time that they come see me at 3 to 5 days of age. Mm-hmm. So hopefully the baby's had a nice, healthy delivery, and they come see me at 3 to 5 days of age, because we like to see them 2 days after they leave the hospital. We do the calculation. If the baby has lost more than 7% of their body weight, we assess breastfeeding. The assessment includes me watching them breastfeed, see what's going on. and then help to figure out where to send them next. And often where we send them next is a lactation consultant to help figure out, hey, what the problem is. So that's usually after me, I send them to a lactation consultant. And if the lactation consultant agrees that there's a problem with the transfer of the milk that cannot be easily fixed by repositioning, sometimes they say there's a tongue tie. And the tongue tie is something that is very common in our community right now as a diagnosis. So I think I'd like you to tell me, how would you handle a baby if I were to send you a baby with tongue tie, Dr. Tadros?
First of all, I just want to thank you for talking about this, because I feel like we need to have these conversations more, and allowing us to just open up and talk freely really helps the patients in the end. So thank you for bringing up this tough topic to address in just the pediatrician sort of community. So I am a physical therapist. I look at muscles, I look at tissue, and I look at function, which is basically how the muscles are working to do these day-to-day activities. So in a baby, function would be how they're eating. And there is quality of movement and not just quantity. So we're not just looking at what they can do, but how they can do it. And so you'll see sometimes that a baby can't open their mouth really wide. You'll see that they are latching very shallow. You'll see that they are chomping instead of sucking. And so what I do is I look at the how, what they're doing, and what's causing that. Is it a question of tight tissue because there may have been a rough delivery? Some babies are born with, tightness in their neck and their shoulders are way up. And I have to figure out, is this tension what's preventing them from eating well, or are they having trouble eating and that's what's causing tension? I always say, think of when you're trying to open like a jar of pickles. When you're struggling to do something, all your muscles tighten up because you're trying so hard and it's difficult. And so sometimes we'll see that so just figuring out the chicken or the egg allows me to help sort of clarify what's going on. The really cool thing about babies is that they respond really well to all these things. So we can go in and I can loosen up the tissue. I can assess their sucking. If they're having trouble sucking, we can show them how and teach that nervous system how to suck correctly. So I would always, of course, I am a physical therapist and maybe biased, but I always think that coming for therapy is a great way to teach the baby before you're sending them off for surgery. And to be honest, I find that the kids that do the best are the ones that have a couple sessions of physical therapy. So we're teaching them how to use their tongue and loosening up some of those muscles. And so then you can really assess the tongue and see sort of what's going on and if they need some additional surgical help.
Understood. So for tongue tie, there's many ways, well, there are certain criteria, I should say, to diagnose it. And I would be glad to help diagnose that if that's the situation. The next move can be straight to surgery, whether it's laser or traditional surgery with a scissor, or physical therapy. And perhaps we should start with at least a couple of sessions of physical therapy and then make a decision about whether the child needs surgery. So Dr. Tadros, if that's the case, how many sessions do you expect, or how long do you think you need to help this baby?
That's a really great question. I usually say anywhere from 2 to like 10 sessions. It really depends sort of what I'm finding and what's going on. Babies that have something called torticollis have a really hard time breastfeeding because they have a really hard time rotating their head to one side. So many of those moms will describe that one side is really hard to feed on and the other side not so tough. So those can take a little bit longer. Babies that have tension and tightness, also that tension has to be released in order for their tongue to function correctly. So anywhere in that range is what I find, from 2 to 10 sessions.
Okay, awesome. So a few weeks, and sometimes it could be just 1 to 2 weeks. That's what you're saying.
Yes.
Perfect. Excellent, thank you. So once you see the baby, hopefully some of the problems have resolved. They come back and see me, and ideally they will have gained about an ounce a day. So we want babies who are breastfed to gain approximately half an ounce to an ounce a day, and we watch that real closely. So we'll ask you to bring the baby back a week after the first visit, and we will weigh the baby, and if the baby hasn't met that parameter, we will move forward with more assessments and more recommendations. So that's our message to you today. Breastfeeding is great. It's important. It should not be painful for the mom all the time, right, Dr. Tadros?
That's correct. That's
Yeah,
correct.
yeah. Sometimes it's a temporary pain at the beginning of the nursing session, but that should not be throughout the whole nursing session. And if it hurts all the time, or if the baby's not growing right, then we should have a discussion about what's getting in the way, whether it's muscle tightness, whether it's tongue tie, whether it's torticollis, which is a stiff neck, and all those things can be addressed if you come to your pediatrician, and we'll help refer you to the right places. Right?
Excellent. Yes, absolutely.
Have a great day. Again, this is Dr. Noha Polack from Progressive Pediatrics in Union City and Bayonne, New Jersey. Please find us at progressivepediatrics.com.
And I'm Dr. Giselle Tadros from In-Home Pediatric PT, where we service kids throughout New York and New Jersey. And you can find me at inhomepediatricpt.com.
All right, great. Thank you.